Assalamu alaikum. Auzu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Now, schizophrenia spectrum disorder. In schizophrenia spectrum disorder, there is schizophrenia, there is BPD, brief psychotic disorder, there is schizophreniform disorder. There are some other disorders, schizoaffective, delusional disorder, and schizotypal disorder. Okay, in schizophrenia spectrum disorder, first of all, schizophrenia. It's a chronic illness causing profound functional impairment. Symptoms category, there may be positive symptom, there may be negative symptom. Positive symptom is a hallucination, delusion, hallucination, there may be auditory hallucination, and unusual thought process, disorganized speech, and bizarre behavior. There may be negative symptom, diminished functioning like flat or blunted affect, apathy, anhedonia, allergia, and social withdrawal. There may be cognitive problem, reduced ability to understand, to make plans, and or diminished working memory or inattention. Diagnostic requires two or more than two active symptoms, including one of the three features: delusion, auditory hallucination, disorganized speech, disorganized or catatonic behavior, and negative symptom. From 1 to 3, 1 must present, and 4 and more, from 4 and 5, if 1 is present, then diagnostic done. This is schizophrenia. And if symptoms is more than 6 months prior to the diagnosis, and it requires more than 1 month of active symptoms over the past 6 months. So more than 6 months is prior to diagnosis, and you need more than 1 month of active symptoms for diagnosing schizophrenia. It is associated with altered dopaminergic activity, increased serotonergic activity, increased serotonin, altered dopamine, and decreased dendritic branching. Ventriculomegaly on brain imaging presence earlier in males than in female. There is increased suicidal risk. Heavy cannabis use in the adolescent is associated with increased incidence and worsened course of psychotic mood and anxiety disorder, typical in schizophrenia. Drug of choice is atypical antipsychotics are the first line, like risperidone. Negative symptoms often persist after treatment despite resolution of the positive symptom. Uh, this is all about the schizophrenia, one of the important topic in psychiatry. This is a very high yield topic. This is a very high yield topic, so I'm taking time to like in schizophrenia, we know then in schizophrenia, drug of choice is atypical antipsychotic. If two or more than two drug fails to control schizophrenia, that means treatment resistant schizophrenia, and schizophrenia associated with suicidality. Drug of choice is clozapine. The side effect is agranulocytosis and seizures and myocarditis and metabolic syndrome can happen. But, but, these things we have to remember that Schizophrenia not controlled by schizophrenia not controlled by two or more drugs. Look for clozapine. So poor response to two or more than two antipsychotic trials. Failure of these drugs. So clozapine is a unique because it has shown the superiority in treatment of treatment resistant schizophrenia. Okay, before jumping into schizoaffective disorder, I would like to uh, discuss regarding schizophrenia. So two or more than two of the following, and delusion, hallucination, and disorganized speech. From these three, one symptom must be present, and from last two, disorganized behavior and negative symptom, apathy, flat effect. One symptom must be present, continuous impairment more than 6 months, continuous impairment more than 6 months, significant functional decline. Antipsychotic is a drug of choice. Adjunct psychosocial intervention like social skill training, cognitive behavioral therapy should be chosen. Family intervention, behavioral therapy should be chosen. And treatment resistance, what you need to do for treatment resistant schizophrenia, you should give clozapine. Okay, the next one, BPD, brief psychotic disorder, more than one positive symptoms. That means delusion, hallucination, disorganized speech, disorganized behavior, lasting more than 1 day to 1 month. Usually stress related. Brief psychotic is it is stress related. So delusion, hallucination, delusion, positive hallucination, and disorganized speech lasting more than 1 day to 1 month is brief psychotic disorder. And schizophrenia from disorder is two or more than two symptoms lasting more than 1 to 6 months. This is schizophrenia form disorder. This is schizophrenia form disorder. So brief psychotic more than 1 day, less than 1 month, and schizophrenia form more than 1 month and less than 6 months. If it is more than 6 months, that is schizophrenia. What is schizoaffective disorder? Schizoaffective disorder shares the symptoms with both schizophrenia and mood disorder, major depressive disorder or bipolar disorder. To differentiate mood disorder with psychotic feature, patient must have two or more than two psychotic symptoms without manic or depressive. And in schizoaffective, more than 2 weeks of psychotic features, psychotic symptoms without a manic or depressive episode. Mood episode with a concurrent active phase of schizophrenia, plus 2 or more than 2 weeks of delusion or hallucination in the absence of prominent mood symptom. Mood episode with concurrent active phase of schizophrenia, plus 2 or more than 2 weeks of delusion hallucination. This is called in the absence of prominent mood symptom. In the absence of prominent mood symptom, this is schizoaffective disorder. Delusional disorder, more than one delusion lasting more than 1 month, no other psychotic symptom, only delusion, no other psychosis. No other psychosis is present. So schizoaffective has 2 weeks of psychotic symptom without manic or depressive symptom. delusional disorder more than one delusion lasting more than 1 month, and schizotypal it's a A personality personality that also falls the schizophrenia spectrum may include brief psychotic episode that are less frequent and severe than schizophrenia. These are all about schizophrenia spectrum disorder. Hope you enjoyed.